Over the next 7 days, we're going to present expert testimony, scientific studies, and medical data in as concise and understandable manner as possible so that you can make wise decisions based upon informed choice. A big part of making wise medical decisions is the concept of informed consent.
The idea behind informed consent is that whenever you do a medical procedure, you have to talk to the patient about the benefits of the procedure, the possible complications with the procedure, and the other options that you may have. So with vaccinations, you have to talk about what are the positives of vaccinating your child, what are the potential negatives of vaccinating your child, and what are the alternatives. And one of the alternatives always has to be not vaccinating or spacing out the vaccines. And the problem is that doctors are incredibly busy. They're getting, they have less than 15 minutes in the office with a family. They hand them a piece of paper that comes from the CDC. That's not informed consent. That's not really saying to them, okay, look at this is really the pluses and minuses. And the problem is that most doctors in America haven't actually taken the time to do the fundamental research that they need to do to figure out what the true risks and benefits are of any given vaccine. So in this country, we don't really have informed consent when it comes to vaccines.
There's a term that I remember vividly being taught in medical school, and that's iatrogenic. So iatrogenic is caused by what we do. All right, if you take
what a doctor does.
Exactly. Okay. So if you take a medicine that I prescribe and it makes you ill or causes you harm, that's iatrogenic. All right, and I think we've lost our way in looking at vaccines and looking at what are the iatrogenic effects. In other words, what harm is being done by our vaccine program. So I wrote this book, The Vaccine Friendly Plan.
Because just so people know, you're not anti-vaccine.
Absolutely not. So the dilemma I was in 2008 after I had those 4 cases of children who regressed into severe autism, and I'd already learned about toxicity. I'd read studies on thimerosal, on aluminum toxicity. I mean, there's books on this topic. I could no longer ethically keep doing vaccines business as usual with the CDC schedule.
If you're going to give parents informed consent before they take these vaccines, don't just tell them that the vaccine was responsible for lowering the incidence of cases of measles. Tell them that there's studies that if you take this, showing that if you take this measles vaccine, you're statistically significantly more likely to be hospitalized after receiving that vaccine. Okay? You're more likely to have epileptic seizures. You're more likely to have allergies as a result of that vaccine. Okay, that's well documented. You're more likely to develop cancers and heart disease in later life if you've taken that vaccine, because it has suppressed you from being able to develop those protective effects that you gain when you are exposed to that disease naturally as a child. So if you want informed consent, you have to have all of that information. Access to all of that information so that then you can make an informed decision, and then you have to be free to accept or reject vaccines.
According to the CDC, there is no federal requirement for informed consent regarding immunizations.
In an attempt to have a safer vaccine approach, I did something in 2008 when I started integrative pediatrics that is pretty much unheard of for a pediatrician to do, and that is to one by one give parents the real facts about the vaccine, the benefits of the vaccine, the risks, and the alternatives. So informed consent. And I truly believe this is what doctors should do. We need to get back to doing that if we're doing something to a healthy person. You got a healthy child in front of you and you're saying, well, we're gonna do this thing to you, this vaccine, and it's a good idea. And all they're being told is it's safe and effective, do it. And oh, by the way, if you don't do it, you're gonna have to leave my practice. That's what's happening today. That should be illegal. I mean, if you have a doctor that's telling you to leave your practice if you don't do what I say, that's called paternalism, and we were taught in medical school that is the worst way to practice medicine. And yet the Academy of Pediatrics is now saying that's okay.
I've learned about the measles, mumps, rubella, that it can wear off, and then they have to do a booster before children go to elementary school. So it's something where it's not 100% effective. It's going to wear off. And the whole theory behind immunization is that we'll get herd immunity. And then everybody will be safe because so many people have been vaccinated. But if I come back to the flu vaccine and talk about herd immunity, if you go on the CDC website, for the last 5 years on average, the vaccine effectiveness was 43%. That means the majority of the people are not protected by the flu vaccine that they've received. And 3 years ago, the vaccine effectiveness was only 19%. That was the year when they just guessed wrong on what the prevalent strains would be during that flu season. And that means 80 out of 100 people were not immunized, were not protected when they received their flu vaccine. These are things that the American public doesn't know. And when we're told you have to have a mandatory vaccination, they're not told that there's a good chance it may not work, and even if it does work, it may only work for a very limited period of time. So these are things of major concern.
כמו שאמרתי, אפילו בספר הלימוד הבסיסי של רפואת ילדים, ויטמין A טיפול לא מופיע בהנחיות במדינת ישראל. לא ניתן בפועל. כשאנחנו דיברנו עם חולים באותו זמן ופנינו להם, שאלנו אותם, הציעו לכם לטפל בוויטמין A? כי רצינו לדעת מה הפרקטיקה שמיישמים פה, איך מנסים לעזור לאלה שאכן חלו בחצבת? כמובן שלא, כי זאת לא המטרה. המטרה היא לא באמת בריאות הציבור. והנה באמת לגבי ויטמין A, כמו שאמרנו, כבר ב-1932, ראינו 1935 תמותה של 3.1 ל-100,000, ב-1932 כבר גילו את היתרון שבתיסוף של ויטמין A, ועדיין שנות ה-2000 אף אחד לא מגלה לנו את זה. היום אנחנו יודעים שהטיפול לחצבת, למשל, למי שיש לו תסמינים, זה ויטמין A במינון גבוה. ויטמין A במינון גבוה מפחית את הסיבוכים של חצבת בעשרות אחוזים. זה משהו שמופיע באתר של ארגון הבריאות העולמי ובכל מקום, ועדיין איפשהו מצליחים להשתיק את זה ולא לדבר על זה. גם ב-2018 כשהייתה את המגפה בישראל, הייתי מצפה שהכותרות בעיתונים יהיו, אם יש לכם תסמינים, קחו ויטמין A. אבל זאת לא הייתה המטרה שלהם. המטרה שלהם הייתה אחרת לגמרי, ואנחנו נגיע גם לזה.
In California, the worst measles outbreak in 15 years is spreading.
The virus is roaring back into the headlines tonight. An outbreak somehow traced to
someone who had probably caught measles abroad visited Disneyland and may have sneezed.
Measles on the march in America.
This outbreak is showing no signs of letting up. There are already more cases this year than there were.
The number tripled to 644 measles cases reported in 27 states.
And I mean, is this all basically because of the anti-vaccination movement, because parents aren't vaccinating their kids?
Yeah, you know, I think so.
A bill that would ban exemptions from childhood vaccines is advancing through the California legislature.
We are authoring legislation that will abolish the personal belief exemption.
I think you're starting to see why it is that mandates are so important.
Let's get to the point. Is measles deadly? I'm bringing on Dr. Bob Sears to get to the heart of that. Bob, can you hear me?
Yeah, hey, Del.
Hey, Bob, thanks for joining me. I know you're in the middle of, you know, a day at the clinic and seeing your patients, so we're going to make this really quick. Is measles deadly, Bob? Can you just give me, like, how do we scientifically look at that? I mean, there's a lot of emotion around this. What do we know about the science of measles and how deadly it is?
Well, the best science we have, Del, is basically what was the fatality rate back in the United States when everyone used to catch measles. When every single child caught it and developed lifetime immunity, the fatality rate was about 1 in 10,000 children who caught the disease suffered a fatality. 1 in 10,000. You know, some adults caught it as well. So if we look at our whole population, it was something like 1 in 500,000 of our entire population would suffer fatality from measles. And so, no, it's not a disease that rampages through a country and kills everyone left and right. You know, we've been very fortunate in the United States, in a well-fed, well-nourished country like ours, where people are not deficient in vitamin A. The fatality rate is extremely low. And we have not had a child die of measles. I believe the last child who died was 2003. Oh, time to go on your show, Del. Sorry.
All right, there we go.
Sorry, it's my cell phone.
So
2003 was the last fatality in a child here.
So I use that. I've said oftentimes it's this in 1960, before the vaccine ever arrives, the death rate of measles is 1 in 500,000 people. I mean, that's a 0.0000 something nothing that you could even imagine. And people say, well, you're manipulating the truth. But it's really not. I mean, I think that's the more accurate way to talk about the measles, because we talk about something that really is contagious. It goes all over. And when you're going to spread hype on your news, telling everybody, you better be afraid of dying of this issue, what you're saying is you personally are in danger. Well, first of all, you are not personally in danger at a rate any higher than 1 in 500,000 people dying. Now, we could get to, and because there's still, you're not all going to even catch the measles. So what you're saying is even those that caught it, and it was contagious, so it was like 3 to 5 million people every year. Of them, still only 1 in 10,000 died. Now, what were those patients like at that time? Were those was that like a healthy, robust, child running around?
Well, it was a mixture. We know for sure if you are malnourished and you're low in vitamin A, as some children were back there, and your risk of dying is way, way higher. We know that for a fact. So you're right. Now we're better at medicine. Now we're better at nutrition. Our kids are, hopefully are healthier or better nourished than they were 50 years ago. And we also know you can use high dose vitamin A therapy. If you're exposed to measles and you get 2 days of very high dose vitamin A, that lowers the complications of diseases dramatically, of measles dramatically. And so, we have better medicine. If you do get really sick, we can hospitalize you and support you. So, if we had measles go around in our population again now, I feel like we would not see a fatality rate of 1 in 10,000 like we did back then. I think the rate would be much lower than that.
Wow.
Del, the reality is, will we have a fatality again in the United States in the years to come? Yes, we probably will. I mean, I think that kind of goes without saying.
Sure.
It has not happened in kids since 2003. When it happens, the crap is going to hit the fan because of the mentality that you were just describing,
right?
Prior to having me on, but what is each individual child's risk of dying if they are caught up in an outbreak and they're a healthy, well-nourished child? That risk is not technically zero, but it's as close to zero as you can possibly get.
I appreciate you taking the time, Bob. That was very informative. Mm-hmm. Go ahead and get back to your patients. We look forward to talking to you again soon.
All right. Thanks, Del.
Thank you. There you have it. If it's even lower, so it's going to be even lower than 1 in 500,000, your risk right now. And vitamin A, hopefully your doctor knows, just take some vitamin A. Don't even come into the hospital unless you're really experiencing, some sort of complications. But let's talk about the deaths. Because they do happen. Very rarely, as Bob pointed out, the next death is going to be the biggest news story there is. And I want to make something very clear, too, right now, that we hear about world death rates. They do this all the time in order to terrify everybody about the measles, saying hundreds of thousands of people are going to die this year from the measles. As we pointed out, if you're malnourished, if you have flies around your lips and you have a distended stomach and you're eating 1 bowl of rice a week, measles is going to be a very problematic issue, illness, infection for you. But so is any infection. Any type of malaria or dysentery, you're going to be in real trouble. But if your child is running around in your yard right now, able to laugh and talk, that child is going to do very well. But I want to bring on Jeffrey Jackson to discuss what are the actual numbers, because we get this question all the time. And I've seen quotes of certain dates. I know Bob just said 2003, but I've heard some other quotes. So we went, and I had Jeffrey Jackson look into every possible measles death we'd had in, say, the last 20 years. So let's have Jeffrey join us right now. Hey, Jeffrey. I'm doing good. How are you doing?
Doing all right.
All right. It's measles mania out there. Every news anchor will say it's deadly. It should be dead. Can we get that little clip of that doctor just saying it's deadly? Just to remind people what it sounds like on the news. Do you have that little short misinformation clip we made? Is that still in there? Hold on. I just want to get a vibe of this because, you know, I kind of want to make fun of these people that really go out of the way to give us a sense of that. I'm making this hard on my team today.
Measles actually kills people.
So measles actually kills people. Jeffrey, when was the last, most recent death from the measles? At least as far as in some reports, I heard something around 2015 or 13. Is there a case in there?
Yes, correct. It's 2015. It was a woman, and she had underlying conditions. So I looked back at the Seattle Times. It was a woman from Washington State. So I looked at the reporting at Seattle Times at the time, and this is what they wrote about it. It was this is a quote: the young woman's health condition was redacted from public records, but it required her to take drugs that suppressed her immune system. She may have been vaccinated against measles as a child, but her family couldn't produce the evidence, which left her status categorized as unknown. So she had no obvious symptoms of the measles, but was tested after she passed away from pneumonia, and she was on immunosuppressive drugs for other underlying health conditions. So that was 2015. And like Dr. Sears said, 2003
well, hold on.
last...
So let me just look at that case, because that's the one that gets thrown in my face all the time. I've said 2003, but this 2015 case, so this is a woman. Let me get this straight. She's in a hospital. She's got some other illness. She ultimately has pneumonia. She's on immunosuppressive drugs. After she dies, someone does a blood test and finds titers, right? Saying her body obviously fought the measles at some point. Was that during an epidemic? Were there cases of measles that we knew she caught it from in that town?
No epidemic at the time. It was. It looked like somewhat of an isolated case, and like it said in the reporting, it wasn't even clear if she had been vaccinated as a child. So her category or status was unknown at the time as far as vaccination status.
So looking at her post-mortem, we just decided she somehow spontaneously exploded into measles that they didn't see. There was no rash. CDC didn't confirm it, but we know that there was some titers in there. And so this is one of the cases that you will hear brought up. Well, there was a case in 2015 where a grown woman died. Well, there's your facts. You can decide whether you want to report that or not. To me, not CDC verified. She didn't come in with a rash or presenting as measles. Nobody even put measles on her chart. But after she died from pneumonia while on immunosuppressive drugs, and probably because of, we don't even know why she was on those drugs, but she was obviously
redacted it from public records.
So there's a very sick woman, and somebody decided to make that a measles case, is what it sounds like to me. So there's your 2015 case. Now, before that, then what is the next runner-up?
So we have a child, like Dr. Sears mentioned, in 2003, and this child was 13 years old, had recently received a bone marrow transplant for a rare disease, and after that had passed away 4 months later. Measles was confirmed after the death once again, so it was not confirmed while the child was living, much like the woman in 2015.
So now, so we have a child in the hospital, bone marrow transplant. And, I have to say, I worked on the doctors, surgeons, are sort of rated by their death rate, right? They're rated by, are they good at what they do? How many bone marrow transplants? Did someone die of a bone marrow transplant? And if you're going to say, I have a lot of success with bone marrow transplants, every death from the procedure sort of goes against you. It certainly goes against being able to talk someone into it. So it'd be really nice if you could say, hey, I had a great patient, bone marrow transplant was doing great, but then they died of the measles. But nobody even saw this kid catch the measles, right? Again, This case, and this one's held up a lot. The child, children die. So this is the kid in 2003 that died. And again, they only find it post-mortem. And the child had absolutely no immune system whatsoever. So I suppose there's a chance, and I say this all the time, and we're going to get into a little bit later, does measles shed? But on the door of that cancer ward, I'll bet you it said, if you've been recently vaccinated, do not enter here. People with, weakened immune systems are in here. Well, why would that be the sign? And we pointed this out. Johns Hopkins and different hospitals have that sign. Here it is. If you have any of the symptoms below, please not visit. Fever, diarrhea, flu-like, sneeze, eye drainage, skin, and if you've had a live vaccine within 30 days, chickenpox, MMR, shingles, nasal flu mist, rotavirus, or yellow fever, do not come in here. So when you hear that vaccines are safe and nobody sheds it, well, that flies in the face of that. Was there a measles outbreak while this kid was in the hospital? Did we have a huge outbreak around that town?
No, there wasn't. It was measles. Measles were, as far as the death was concerned, there was nothing else going on, obviously, and the numbers were nothing substantial in that town.
So no measles. In fact, my understanding of that story is they don't even know where he got it because it wasn't anywhere in the city or state at that time. Okay, so before that, so that's 2003. I know a lot about that one. Now, then what's the next one that we see?
Well, during this comes from the Journals of Infectious Diseases. They did a kind of retrospective study, and during 1993 to 1999, they can only find one acute measles-related death reported to the CDC's National Center for Health Statistics. So there's a pretty big gap there with measles. I looked through a lot of the reports, the summary of notifiable diseases for the CDC for almost 2 decades, or a little over 2 decades, and there wasn't too much to be talked about. They have ICD numbers in there. These are the health system's medical diagnosis that they kind of slap on for measles. So there was a couple numbers there, but those aren't lab confirmed. So that's a whole different story. That could be anywhere. It's like saying someone passed away of pneumonia, and you can say, well, they died of the flu because they didn't get the flu shot that year. But it's kind of like a catch-all diagnosis. So when we're looking for lab confirmed, that's when we're having the problem here, really going back in the last couple of decades and finding these cases.
Right. And this is something, Jeffrey, that I keep pointing out. It's amazing because this isn't the first year we're hearing measles is deadly. We all went through the Disneyland outbreak, deadly measles, deadly measles, deadly measles. Am I the only one in America still alive? And I'm speaking to all of you out there. Am I the only one that, wants some accountability from my news agencies? I mean, am I the only one that says, if you're going to say something's deadly, I want to see a death? If you're going to call it a deadly snowstorm, how did someone die from the snow? Like, I need to see a death. Usually that's like a car accident or something, but someone has to have died. And now, year upon year upon year, deadly measles, deadly measles, deadly measles, deadly measles, and no one's dying. And right now, we're up over 700 cases that we know of. I would guess that there's a lot of people that are having measles parties right now quietly because you've got this terror now. You have a government that's deciding to quarantine people and saying you're going to be banned from the streets and public spaces. Well, when you start hearing that and you're saying, and the only way in the future I can, avoid being quarantined or put in a cell block, or is that I'm going to just have had the measles? I mean, they're driving people to measles parties. It used to be something fun you did just to get out of the way. Now you got to do it to make sure that your kid's going to be able to freely walk down the street the rest of their life without being quarantined. So I imagine that the numbers are much higher, but where are the deaths, folks? Doesn't it bother you to hear every news anchor you trust, every medical reporter tell you it's deadly, and yet in the giant measles outbreak, around Disneyland, and during the one right now, nobody's died yet, nobody's dying. Does it feel like this thing's being sensationalized? At least a little bit? At least a little bit? Well, so Jeffrey, thank you for pointing it out. So in the last 20 years, we have about 3 cases. 2 of them are really debatable whether they're even decent cases. And so, there we have it.
אז כשהם אומרים לנו 1 ל-1000 וכשהם אומרים לנו 1 ל-500, אז בוודאי שלא רק שהם טועים, הם פשוט משקרים. אוקיי? כי אני מניחה שהם יודעים יפה, כמו שאני יודעת להגיע לנתונים האלה, גם הם יודעים להגיע לנתונים האלה.